Well, I think, as the Prime Minister explained, that the diversion from a criminal justice system to health and social services requires that kind of partnership and a ramping up of the kind of social services that need to exist. And that was very much part of what the BC application outlined. What is the scope? What are the plans to divert from criminal justice to social services? What are the additional health and social services? What is the training of law enforcement? What is the public education? And most importantly, putting in place the kind of indicators and process to keep measuring, so we can measure, adapt on any of the indicators that are to do with public health or public safety.
But do you foresee that this is the first step in going towards a national policy?
I think that, you know, what we're seeing is we've had an application from Toronto Board of Health. I know I texted Mayor Sohi last night because I think we want to get to work with, they've passed that in Edmonton. In Saskatoon, it's actually the police that are talking about an application. And so I think everybody feels that because BC has been the epicenter, they've done a lot of work on law enforcement education, they've done tremendous work with us on all of the other harm reduction approaches, the safe consumption, safer supply, all of that, naloxone, all of those things. So we know decrim is just one of a multitude of this sort of interventions that we can make to stop this terrible tragedy, but we are very open to working with jurisdictions coast to coast to coast. But it will be this period of the pre-exemption in BC where we work with the partners to develop the indicators, the process for how fast we get the real-time data to make sure there's no unintended consequences, that it will be a learning system, and establish those baselines so that when it comes into force January 31st, that we will be able to see the outcomes, but be able to adapt on any unintended consequence of this. So that, I think all the other jurisdictions will be interested in learning from the BC experience, and we'll be there working with them as we go.
So you do sort of see this as the first step to moving towards bringing this in all parts of the country?
Well, I think it's certainly always been it's been our goal. I think some of you have heard me say before, my dad was a police officer before World War II. To the day he died at 93, he never thought prohibition worked. I think that but it is a matter of us making sure that we do understand trauma, understand culturally safe services, understand that a lot of people using drugs have never had a trusted relationship in their lives, and that we need to listen to the people using drugs, those with lived and living experience, but the experts, the frontline providers. But I think what we talked about a lot while we were in Vancouver Monday, Tuesday, is really accelerating the access to a regulated supply is going to be really a challenge, but one we know we can do. That people are dying because of the toxicity of the supply, and that we are, and that's why the money that we announced yesterday, the $11.7 million for the substance use and addictions programs, and that the work that we're doing with CIHR in terms of the research around what works, what doesn't work, in all of these innovative and creative things and that's why I think we've had a very good working relationship with British Columbia on these things that they've been working on really since Perry Kendall declared the emergency in 2016.
Minister, I just want to be clear with your words. You just said it was your goal. So is it your goal to bring that BC model to all the other provinces?
Well, I think that our goal is to save lives. And so our goal is to examine the BC model, make sure that it is achieving the intention of both both public safety and public health, and that we will watch carefully what happens in British Columbia, and then we know that other jurisdictions will be interested in those results and are preparing their own path. The 4 drugs that are in the plan in BC may not be the 4 drugs that another part of Canada would want in their application. So there are different local realities, and it's really important, that we don't open the door to organized crime, and that is why it's exciting to have the Canadian Chiefs of Police and BC Chiefs of Police with us as we take this step, and that's really is the dual goals of public health and public safety, saving lives.
Minister, what tells you that BC has the wraparound supports that are needed?
Well, we watched them on so many of the things, whether it's particular. I mean, they were the first ones to do safe consumption, with the Inside program. They then moved that to on-site, where people thinking about coming off drugs could go upstairs and into a residential setting that would give them those sorts of supports. I think they've always been innovative and creative in the ways. Dr. Christy Sutherland's in Portland, in the Portland Society, is moving on powdered fentanyl, working with people using drugs to get that regulated pharmaceutical grade medicine for her patients. And so we are, that's what all of our SUAP money across the country is paying and supporting this kind of innovation and creativity. But also we know from social housing to all of the things that people need, the rapid housing initiatives, that BC has been a very good partner in creating and committing to the ramping up of the health and social services for people using drugs.
What is your message to cities? You're an Ontario MP. I'm thinking about Northern Ontario, Sudbury at home crisis. What's your message to the city? Can they ask you for something? Can they say we want like BC?
Well, I think that, it's like the 2 doctors in Timmins that are using Sublocade. Different jurisdictions are trying different approaches, and of course First Nations. I met with the councillor from Old Crow this morning about what they might be interested in doing in setting up harm reduction in that fly-in community. So it's going to be different across the country, but I think that all of the the big city mayors, I think, are meeting today. That there are, the Federation of Canadian Municipalities are I think exploring all of the things people are trying across the country, and that's why I think this is really important first step. That big iron steel door that no one thought would ever crack open, we've opened that yesterday, and now we'll have the tight monitoring system to make sure that we are really getting the outcomes that we need, both on public health and public safety.
Okay, I apologize. Truly, one more question.
You said there were different region realities. For example, you said Timmins. Could you see a city like Timmins or a municipality like Sudbury, for example, do this kind of thing like did in BC only locally? Could you be open to do something like that?
Well, yes, we've already received an application from the Board of Health in Toronto. Now, obviously, that's bigger, but I think all of the municipalities and regions, townships, any group that is interested in coming together with a comprehensive plan for both the public health and the public safety is important, and that's why having the law enforcement from across the country with us on this journey is going to be very, very important, because they have been very clear with me that organized crime and gangs can pivot very fast, and I think a lot of you know what happened in Denver. They've now had to go back to from what was 3.9 grams to 1 gram, just because the gangs and organized crime were able to pivot so quickly, and it became dangerous.
Why are we consulting with the provinces on decriminalization? Mr. Kenny is complaining about that. The provinces haven't been consulted on decriminalization.
First of all, this is the domain of the Minister of Health under the Health Act, Section 56. This is something that they have done with British Columbia. There isn't, at this stage, any larger discussion on decriminalization. This is just a specific measure that's being taken under the Health Act in British Columbia.
But did you learn Alberta that this was going to be happening? Did you
Pardon
learn
me?
Alberta as a neighboring province that this was going to be happening?
It's not my ministry. This is under the Minister of Health.
Cet après-midi, il y a le vote sur le projet de loi 216 du NPD sur la décriminalisation justement nationale. Est-ce que vous pensez qu'il faut y aller avec une approche pan-canadienne ou c'est mieux d'y aller à la pièce quand il y a des demandes qui viennent, par exemple, de la Colombie-Britannique, de la Ville de Montréal?
Encore une fois, c'est quelque chose qu'on devrait étudier, mais on ne va pas là pour l'instant. Pour l'instant, on procède avec ce que la ministre de la Santé mentale est en train de faire avec la Colombie-Britannique. Mais il faut regarder tous les enjeux, évidemment, en tant que gouvernement, mais on n'est pas là.
So
Donc, c'est
will you
trop
support
rapide.
it? Will you
C'est trop
support the
rapide,
NDP bill?
C'est 216. Comment ça va s'organiser? Est-ce que c'est un vote libre ou sur la décriminalisation?
Comme j'explique, à tous les votes qui ne sont pas dans les catégories bien connues où il s'agit de vote de confiance, évidemment, évidemment, c'est un vote libre.
Mais sauf pour le cabinet qui vote ensemble, j'imagine?
Ben,
C'est ça le principe.
c'est l'essence.
D'accord, merci.
demande qu'on lève les mesures sanitaires pour les aider. Là, ils sont en congrès ici à Ottawa, puis ils font comme... On était les premiers touchés, puis on est encore touchés, puis on a encore des mesures sanitaires. Pourquoi est-ce que ce n'est pas le moment de faire comme d'autres pays et de lever ces mesures sanitaires-là pour les voyages?
Je pense que ce n'est pas unanime à travers le pays ce que les pays ont décidé. Regardez, on a déjà Israël qui a ajouté une 3e dose pour être considéré comme pleinement vacciné. Comme j'ai dit depuis le début, comme ministre du Tourisme, la santé en premier, ensuite le voyagement. Et peut-être vous savez que j'ai le COVID. Moi, je suis fini avec le COVID comme être humain, mais le COVID n'est pas fini avec nous. Et on voit dans nos hôpitaux et tout ça que les chiffres restent assez élevés. Et la grande question, c'est qu'est-ce que la vague va nous faire? Est-ce qu'il va y avoir une vague à l'automne? Donc, c'est une conversation. Je sais que ça préoccupe le secteur du tourisme, mais en même temps, on voit que ça monte en flèche. On avait déjà 2 semaines en avril où on était plus que 1 million de gens par semaine qui viennent au Canada. On a enlevé le test PCR, on a enlevé le test rapide. Si on veut aller aux États-Unis, il faut un test rapide. Donc, je pense qu'on a un bon équilibre pour le moment et on suit le dossier de très près.
Donc, jusqu'à l'automne, c'est ce que vous venez de me dire, là, parce que vous craignez une vague à l'automne. Donc, tout l'été, on va avoir des mesures.
C'est pas ça que j'ai dit. Ça, c'est une conversation active. On veut garder les Canadiens en bonne santé et on veut aussi protéger le fait qu'on a un avantage compétitif, qu'on est un des endroits les plus sécuritaires au monde à venir visiter. Donc, c'est une question complexe et comme vous savez, les parties prenantes dans le secteur du tourisme poussent et moi, j'ai ces conversations au sein du cabinet aussi.
Okay,
merci.
Vous parlez d'une vague à l'automne, mais le gros de la saison touristique, c'est l'été.
Oui.
Là. Donc, pourquoi est-ce que vous ne levez pas les mesures? Je pense par exemple aux tests aléatoires aux aéroports. Pourquoi est-ce que vous ne levez pas ça pour l'été, puis en disant, bien, à l'automne, on verra ce qui se passe, on réévaluera? On
est en train de regarder tout ce qui sont les petits blocus, les bouches-trous aux aéroports, aux frontières. Et c'est pas évidemment, c'est pas complètement évident. C'est pourquoi on a le groupe de travail dans tous les ministères avec l'ACSA, avec l'Agence frontalière, Santé publique et nous. Donc, si on peut enlever les bouches-trous, c'est exactement ça qu'on va faire. Et la conversation sur les mesures sanitaires, les mesures obligatoires, c'est une conversation active. Merci. Merci.
Mr. Boissonnault, do you think it's going to be tough for your province to, adopt a similar program that Vancouver is adopting, like the decriminalization? Because Edmonton, I believe, is calling for the same thing, right? How easy do you think that's going to be?
It's a shared jurisdiction, and we need the support of the province to head in this way. I mean, we are dealing with a great tragedy in Chinatown with 2 people who were recently murdered in Chinatown, brutally. We have a high count of homelessness based on the pandemic. It doubled. The homelessness count doubled. And we need to work with all orders of government. Minister Amarjeet Sohi, Mayor Sohi and I have worked very closely on this, but we need provincial partners if we're going to have a model like this. So I'm very interested in seeing how the BC model unravels, but not unravels, but unfolds. But here for Edmonton Centre, for Alberta, we need a provincial partner. And Mayor Sohi's been very clear about this, that whether it's figuring out how we approach policing, how we help people that are facing trauma and addictions, we got to have a compassionate approach. And the province hasn't been there to date.
Okay, so do you think that, what sort of roadblocks do you think the province is going to put up?
That's a question you have to ask the province. I know we are interested in making sure that we help people who have addictions, who need trauma mitigation. At the end of the day, we want to make sure that people are safe.
How are you going to work with the province? Because like there are concerns about, you know, a safe supply and whether there's enough addiction beds and stuff like that. Because it's not just.
We're doing everything we can with the province. At this time, as you will understand, they are going to get ready for a leadership review, and so this is complicating matters. And so we have the overtures. I think Mayor Sohi met with Minister Shan this week, and so I'm interested to see how that went. But my colleagues are focused on this, and as Minister for Alberta, I want to make sure that we have a process, we have an approach that is compassionate and that saves lives.
So do you imagine this will be easier once the UCP pick a new leader to have those conversations?
I hope so, and I hope that the UCP leader understands that whoever they are, that they serve all Albertans, and that we have, I mean, for example, if we could have shelters that would be 24/7 instead of 12 hours and they kick people out on the street, that would also help people. What would we all do if we were kicked out of our homes for 12 hours a day? Right? Where would we go? What would we do? And so a compassionate approach to making sure that people are safe and that they have the care and supports they need is important. And when it comes to our social and affordable housing, we need the province to play. Like, we are ready to build housing. Mayor Sohi's ready to make sure those houses get built, but we need 24/7 wraparound supports, and Alberta Health Services and the province need to be at the table, and that piece is definitely lacking.
And travel restrictions are being extended until the end of June. You kicked off Tourism Week earlier this week. Are you worried that that's going to deter people from actually getting on planes, trains, and automobiles?
The numbers we're seeing are the best we've seen since pre-pandemic times, and that's numbers we get from Destination Canada, from the destination marketing organizations. We could see a spike as soon as we took PCR tests off. We saw another spike when we took the rapid tests off. If we want to go to the United States today, you've got to have a rapid test to do so. We're going to keep working at the airports and the borders to make sure that we have travel that's as frictionless as possible. And I'm going to say what I said when I first went to the Tourism Industry Association of Canada, which is safety first, then travel. This is an active conversation inside our government, and I'm going to continue to work to keep Canadians safe, but to make sure that the tourism sector can fully recover.
And if Flair loses their license today, are you worried about the impact that could have on tourism?
Look, that's a decision between the regulator and Flair. I'm a fan of ultra low-cost carriers. I mean, it's interesting when you take a look at who competes with ultra low-cost carriers. It's not the big air carriers, it's the couch. So we want people off their couch, and we want people to realize that they can travel across the country. I mean, I think at one point it was $180 to get between Ottawa and Edmonton, both ways. And so you can't even go across the country in your car for that. So I want to see ultra low cost carriers that are following the rules, and I look forward to I will look forward to seeing what the decision is today. Thanks, everyone.
If they lose the license, what worry?
Can I get your thoughts on the official language committee this afternoon, Mr. Robinson? What do you want to hear from them?
I mean, I'm looking forward to the committee members to asking her questions, and I know CN recognizes that this needs to be corrected. Our government made our voice very clear that it's important to have, first of all, people are able to work in the language that they choose, that customers are able to receive service in the language that they choose, and it's important that CN sets an example with its leadership, that we have representation, including francophones from Quebec. Thank you.
The airline industry came out today and said they want the ride Canada drop, they want other mandates drop. What's your reaction to them calling so publicly for those things to be removed?
Look, the airline industry has suffered a lot over the last 2 years. We were there for them. We supported them during this difficult period. The good news now is that we're seeing tremendous demand for travel, and that's good. Now we're working with them on identifying bottlenecks? How do we release some of the pressure that many airports are facing, the industry is facing? We're learning also from other jurisdictions. We're seeing that happen around the world. So we want to work with them to ensure that we improve the experience for travelers.
You mentioned bottlenecks. Do you think a part of the problem is some of the smaller airports, Ottawa, some of the other areas, don't get those direct flights that they used to? Most of them are going through the big hubs like Toronto, Montreal.
So one of the things that I talked about, the causes for these bottlenecks, is that there's still, we have extreme peaks and valleys. There are times of the day where a lot more of the airlines are, they still have not returned all of the flight schedules that they had, but there's more customers wanting it. So there are extreme peaks that we're seeing, and we need to deal with those.
Just one more thing. Flair Airlines, the announcement from the CTA is coming out today. They've come out and said, whatever CTA is going to do, we're going to continue to fly. What's your reaction to that? And is your expectation they're going to be able to continue to fly, and that passengers who bought tickets will be able to have their flights?
I was just in caucus for the last 2 hours, although I was just informed that CTA has released its decision. So I haven't read it yet.
Do you know what the decision is?
I have not read it yet, so I'm not sure. I don't want to speak about it, but it was just released, and I think it's public now.
Perfect.
Thank you.
Du Québec, est-ce qu'il serait temps qu'on lève certaines mesures sanitaires comme l'obligation vaccinale pour que les gens puissent prendre l'avion et le train puissent aller...
Mais nous, on va toujours suivre la science et de s'assurer qu'on prend les meilleures mesures pour l'ensemble. Puis on comprend très bien à quel point ça peut être difficile, mais c'est pour ça aussi qu'on a plusieurs programmes pour à la fois l'industrie touristique, culturelle et autres aussi.
Parce qu'ils demandent, l'industrie touristique du Québec, notamment, disent, écoutez, là, il est temps qu'on lève ça, ces restrictions-là. On était les premiers touchés, qu'on est encore touchés, on est les derniers à en sortir. Pourquoi est-ce que le gouvernement ne lève pas simplement ces restrictions?
Mais encore une fois, on évolue ça de façon régulière, je vous dirais même au jour le jour, en parlant avec Santé Canada et la santé publique du Canada. Alors, on va toujours écouter la science.
L'industrie touristique au Québec, là, demande qu'on ait finalement, qu'on enlève les mesures sanitaires pour être capable d'avoir plus de monde. Ils ont été les premiers touchés, ils sont pas encore touchés. Est-ce qu'il est temps qu'on fasse quelque chose pour les aider, l'industrie touristique?
Bien, écoutez, ce que je peux vous dire au niveau de l'industrie touristique, là, ce qu'elle a besoin actuellement, là, c'est qu'elle a besoin de main-d'œuvre. Ouais. C'est vraiment majeur au niveau de l'ensemble du Québec, puis pour les régions. Fait qu'on commence par régler la main-d'œuvre dans l'industrie touristique.
Mais justement, la main-d'œuvre est prise avec les vérifications sanitaires.
I wanted to check in with you about where you're standing right now on the status of vaccine mandates and hybrid sittings for Parliament beyond the spring.
Sure. Well, in terms of the requirement for MPs to be vaccinated, we know that being vaccinated provides the best protection against the COVID-19 virus. We know as well that members of Parliament are in a unique situation, traveling from communities across the country and entering here into the chamber. So it's important to continue the vaccine requirement and being vaccinated and continuing to have vaccines administered is the best way out of this pandemic. In terms of the hybrid provisions, we know we are having conversations with the other House leaders. We're still in the pandemic. We watched, during the Omicron period, where we were hoping that we were out of the pandemic and we were returning to a sense of normalcy. We used the hybrid provisions on a dime to adjust to the public health measures that were there. But those conversations are ongoing, and I continue to talk with the Bloc and the NDP about their thoughts on the extension of any hybrid provisions. The Conservatives have made their position clear.
Do you think that there is a place for having hybrid provisions made permanent?
I don't think that question is for now. The question right now is the pandemic and how we continue to navigate it as a Parliament to make sure that the work of Canadians gets done in this building. The contemplation of the utilization of anything that might have been used during the pandemic after it is premature.
And when it comes to vaccines, there's a lot of talk that 2 doses as a mandate is no longer the same as it was in the fall, that we need 3 doses. Is that something that Parliament would be considering moving the mandate towards?
I think that at this, at the Board of Internal Economy, we always have conversations around the health and safety of the precinct. Those conversations are based on the advice that we get from public health and from House administration, and so we're always evaluating what's the best way to have health and safety protected here in this place.
But right now it's still 2 doses?
As of right now, yes.
Question for you, for the hybrid parliament, isn't that a way to attract more people so that it's flexible? Women with kids, for example, I'm assuming, and even daddy who stay at home, can you concilier travail-famille, if I may say, with the Parliament? Could that be part of the discussion that you will have with your colleagues and House leaders?
I think any question about the use of hybrid provisions outside of the pandemic is premature. Okay. And I do think that we need to have a robust discussion as parliamentarians about what may or may not be used on a future basis and what the relative merits or problems with the utilization might be. We're still in a pandemic. It continues, and we need to be able to remain flexible. But I think right now that's what we need to be focused on, and there needs to be a deeper conversation about, and frankly, we have time for that conversation. We're still in a pandemic, and we have time before the pandemic is no longer present to contemplate what a post-pandemic reality would be.
Is the Liberal position that you would like to see the hybrid set format continue in the fall?
I think our position right now is that we're talking with opposition parties about what the best way to move forward is. We're in a minority government. It's important that we work with other parties on this. I wouldn't want to be prejudicial to those conversations by standing where we are right now, but those conversations are important, and recognizing that we're still in a pandemic reality is something that we have to be aware of.
Okay. When do you plan the session to end?
Well, we have a lot of work in front of us. We have an enormous amount to do. So at this point, I see us using the full calendar.
Okay. Yeah. Until the 23rd.
At this point, yeah.
Get ready for stand up. That's it.
Yeah, exactly. Thank you.
Republican Marjorie Taylor Greene says that Canada is vulnerable to a Russian invasion because of our handgun freeze law legislation that's been put forward. How do you react to that?
Well, okay, sorry. So first and foremost, I would say that Canadians wanted us to go ahead with stronger gun control rules, and they gave us a mandate to do that during the last elections. And for the rest, we're just not interested in her opinion.
Are we vulnerable, though? Like, do we have a weak military? Not arming our citizens, does that leave us vulnerable, in your opinion?
We're just not interested in her opinion.
En tant qu'ancienne ministre des langues officielles, le PDG du CN témoigne aujourd'hui. Quelles sont vos attentes pour ce témoignage?
Écoutez, il y a une excellente ministre des Affaires des langues officielles qui s'occupe du dossier, alors je lui fais confiance. Merci.
En tant que gouvernement du Canada, on ne veut pas s'interposer entre les survivants, puis leur capacité, puis leur habilité, puis l'occasion qu'ils ont
de relayer leur message directement.
Oui, de parler directement aux impairs. Ceci étant dit, il y a un gros travail d'accompagnement des survivants, évidemment, étant le pays hôte pour une visite qui est de la nature d'un chef d'État, évidemment, pour l'entourer. Donc, je serai... je présume au moins à Iqaluit, puis à Edmonton, puis on verra pour Québec.
OK, pour accompagner les peuples autochtones.
Pour accompagner, puis continuer le travail qu'on doit faire.
Qu'est-ce que ça va représenter, cette visite-là, pour les peuples autochtones, tu penses?
Pour eux, ce qu'on a dit haut et fort, puis l'opinion est partagée, puis il y a plusieurs volets d'approche. Il y a certains qui veulent rien savoir. Il y en a d'autres qui sont neutres, puis il y en a d'autres où c'est une expression très profonde de conciliation et d'excuses présentées sur le territoire canadien, comme l'a été réclamé dans la Commission Vérité et Réconciliation. Puis il y en a qui s'attendent simplement à entendre « je m'excuse » pour pouvoir passer à une autre étape de la guérison. Donc, on s'attend à plusieurs opinions partagées et je présume que les émotions seront vives aussi avec la venue du peuple.
Dans toute la démarche de réconciliation, qu'est-ce que ça représente, cette visite-là, dans l'ensemble de la démarche vers la réconciliation avec les peuples autochtones?
C'est un pas important, sachant que l'Église catholique était responsable de l'administration des 2/3 des institutions. Ce sont des excuses qui se font attendre depuis fort longtemps, et évidemment dans l'optique d'excuses présentées notamment par l'Église unie, l'Église anglicane.
Il y avait juste l'Église catholique, finalement, qui traînait de la patte.
Qui traînait de la patte pour une raison ou une autre qui est assez connue, mais c'est l'occasion vraiment d'entendre ces mots d'une figure diplomatique internationale, somme toute, qui est inspirante aussi, donc, dans le pape François.
Et durant cette visite-là, évidemment, les projecteurs de la presse internationale vont être braqués sur le Canada. Est-ce qu'on craint aussi que peut-être le traitement réservé aux peuples autochtones revienne un peu hanter le gouvernement canadien?
Il ne faut jamais craindre la vérité, puis qu'elle soit bonne ou mauvaise, dans ce cas-ci très mauvaise. C'est la nature d'un gouvernement responsable d'en passer à la vérité. C'est un processus très humain de vouloir cacher, de réprimer la vérité. Et c'est une chose qui a été faite vis-à-vis des peuples autochtones de façon délibérée parfois dans notre histoire. Mais de faire face à cette réalité, je pense que ça fait preuve d'une certaine maturité de notre gouvernement, de notre pays, dont on peut être assez fier.
Très intéressant.
Question?
Très intéressant.
Si on regarde la décriminalisation de certaines drogues dures encore aux États-Unis présentement, pour ce que vous savez, par exemple, de la région de Montréal, est-ce que vous pensez que ce qui se passe présentement avec le Colombie-Britannique pourrait encourager Montréal à aller davantage de l'avant plus rapidement dans le dossier? Est-ce que vous avez entendu des échos?
Moi, je suis encouragé. Ça prend encore l'approbation de Québec. Question de juridiction, de capacité effective de pouvoir procéder à un processus pour des gens qui sont en situation de dépendance et qui veulent une approche du 21e siècle pour combattre un fléau. Je sais très bien comment ça a pu sévir dans les communautés autochtones, l'impact que ça a pu avoir. Encore manque-t-il de ressources à Montréal pour pouvoir accompagner des gens d'une façon sensée. On sait que de tout criminaliser, ça n'aide pas les personnes qui sont dans le besoin et qui sont frappées par le fléau de la drogue. Ça peut frapper des plus jeunes aux plus vieux. Donc, c'est un projet. On l'a entendu, puis on a eu le débat avec la légalisation du cannabis. Ça ne fait pas l'unanimité au sein de la société, puis une réflexion, un débat de société à faire. Mais si on regarde les faits, si on regarde l'approche médicale, c'est la bonne chose à faire. Faut-il encore l'approbation de Québec et des autres provinces?
Donc, si on regarde le cas de Montréal spécifiquement, vous attendez à ce que le bas blesse à l'Assemblée nationale plus qu'au bout de Mme Plante, c'est ça que vous dites?
Je ne pourrais pas spéculer de l'opinion de la mairesse là-dessus, mais je présume qu'elle est à l'affût de tout ce qu'elle voit dans la rue, puisque je vois aussi comme députée du centre-ville de Montréal. Donc, je ne sais pas où il y aura de conflits. Je sais où il y en a eu par le passé. C'était avec Québec, mais on verra. Puis on verra avec l'exemple et le leadership de la Colombie-Britannique.
Merci beaucoup.
Merci.